All right. Good evening, everyone. I see a lot of people coming in, so we're going to go ahead and start very slowly. My name is Dr. Z. I'm one of the owners and medical director of Hebe Medical Spa. We've been open in Fishkill since 2018, and I'm very excited to talk about one of my favorite subjects, which is women's health. And before diving in, I'll tell you a little bit about how this passion evolved. So when myself and my business partner Irina opened Hebe in 2018, we went into this because we really loved beauty, we loved skin, and we wanted to, that was our forefront of, the main reason why we started Hebe. But then because I'm an internal medicine doctor and I couldn't help but notice when I was going to many different conferences that I had to include hormone health because we can make women feel good on the outside, but what about the inside as well? And one of the things that I noticed was that I wanted my medical spa to be different from the others. I wanted it to be all about beauty from the inside out. So 10 years ago, I was like, we have to include hormones. And it's so interesting where hormone health in women's health, where it is today, because for me, it was much harder 10 years ago to convince people that this was important, that we needed to talk about hormones. And I got so much, backlash from physicians of my patients. But nonetheless, I believed very strongly in this. And I helped a lot of my patients, and then they started to feel so good. And now, fast forward 10, almost 10 years later, women's health is being accepted, and the FDA has actually removed a lot of the black box warning from the hormones. And social media, I mean, everyone's talking about it. I mean, everyone claims to be an expert now. So for me, this is like a moment I've been waiting for. And so I'm so excited to talk about this and to tell you how much experience I have outside of just what the data holds. I have a lot of personal stories and experiences. And so I feel very confident in what I can do for my patients from a standpoint of women's health. So let's get right into it. Okay. Second. All right, here we go. So why does women's health, why does it matter? So as women, we do a lot. We're moms, we work, we have careers, we have families, we have relationships, and oftentimes um our symptoms and our feelings, can often get, sort of dismissed. And we are almost underdiagnosed in every avenue of medicine. And especially in hormone medicine, because unfortunately in medical school, we are not taught about hormone health. But we are starting to understand it more and more. So that's why a lot of my patients, when they go to their doctors and they are telling them about their symptoms, they are, either told it's normal or they're given like an antidepressant. I see that a lot. So some of the common symptoms that, a lot of my patients feel are fatigue, they're gaining weight. I mean, they're having brain fog, and they're not able to connect why they're feeling this way because all their labs are looking normal, and the doctors are saying, "Well, I don't see anything wrong with your labs, so this must be something else. This must be in your head." And a lot of the times my patients are like, how do I know? How do I know that I have hormone issues? And I think Marie Claire, one of, a very respected OBGYN in social media, if you follow her, says it very nicely. She says, when you don't feel like yourself. And I think that is such an important statement because you know when something is wrong. And I'm going to be 44 this year, and I knew at age 40 something was not right. And I will also share my story as well as we move through this. This is why I'm even more passionate because, I myself do take hormones. So, and I felt exactly that way. I didn't feel like myself. I thought I was going crazy. I had, lots of anxiety. I was feeling like, the gym when the way that I used to, lift in the gym, it wasn't nothing was the same. So my sleep was off. I was waking up in night sweats. I mean, it was a very difficult time for me. So this is why it's so important to see this in a different way and see this in the lens of a functional medicine or a lifestyle or a wellness doctor. So functional labs, functional labs are different from the labs that you may be doing with your physicians because they are looking at your labs and then they're looking at the reference ranges. And as a functional or wellness doctor, we don't do that. We look at symptoms first and then we look at labs after. And then our optimal ranges for a lot of things, which I will get into, are different from your traditional doctors. So, when a patient comes to me for a wellness or a hormone consultation, I never look at the labs first. I want to hear the story. I want to diagnose this simply first by hearing the story and then use the labs as a confirmation. Okay? So, a patient will come in and some of the symptoms that they may say is fatigue, you know, their weight is like not changing. They're breathing and they're gaining weight. This is a common thing that I hear, and it's always sitting in the same spot, the tummy or the hip area. Mood changes, bloating, inflammation, the hair is thinning, they can't sleep, and again, they're not feeling like themselves. So the functional lab, what it does which is different from traditional labs, it looks for the root cause and not just sort of manage symptoms. Because if we manage these symptoms, everyone's going to be on a antidepressant, and everyone is going to be on, all these random medications, and then next thing you know, you have a laundry list of things, and nobody has looked for the root cause. So the goal is to optimize to find to find if the symptoms that you are having is hormone related, and then also look at other things to rule out as well. So when I am looking at your hormones, I also look at other things because sometimes these symptoms you're having can overlap with other diseases. So, such as thyroid being one of them, I always look at the thyroid to make sure that is that a possibility as well that you're having? Are they actually overlapping as well to some extent? Because whenever there's a shift in hormones, there's a shift in the thyroid. Because if you actually look at the thyroid, it has estrogen receptors around it. So it makes sense if your estrogen is down or your hormones are down, then your thyroid is not going to work well. Same thing with every part of your body. So this is why I also look at B12 because if hormones drop, B12 will drop, and B12 is essential for your detoxification and getting rid of inflammation. So absolutely, I'm going to optimize it. So B12, my patients need to be at a range of 1,000. Now, if you do it with your physicians, they're going to see 600, they're going to see 300 and 200. And some of the labs say that's normal, but to me, that's not normal. So my patients will have to take a B12 supplement to optimize their B12 so they can detoxify their body from inflammation. Okay. Vitamin D is another important nutrient that we see. I see this number low on 80 to 90% of my patients, which is crazy. But we're living in a world where this is happening. We're indoors, we are wearing sunscreen, we are not out as much as we should be. So this number needs to be about 80. But if you are doing it with your doctors and they see 30, they'll say, oh, your vitamin D is normal, but not for a wellness doctor. That's not normal. So we make supplement, treatment plans for you guys. And again, thyroid panel, I want to see if your thyroid is slow or is it too fast? Could this be a problem? And then, of course, we look at estrogen, progesterone, and testosterone. So those three are going to be the key players if we're looking at hormones. And for every woman, so there are some numbers that I look for in this area based on my expertise and going to several conferences and talking to many colleagues in this field. So we've been able to come up with some reference ranges, but it doesn't always hold true for everybody. So I have to treat each patient like an individual, and I really have to match the symptoms to a lot of my things. So this is where wellness doctors and longevity doctors are so different from traditional. We really want to look at the patient, okay? So now, if your doctor decides or you decide that you want to go into, hormone replacement therapy, I highly recommend that you consider, bioidentical versus synthetics. So bioidentical, the reason I like them is because they're structurally identical to your own. So when your body accepts this, it really just thinks it's exactly, its own. So it doesn't treat it like a foreign object or anything like that. Synthetics, they're still good if that's the only option you have, but it's not natural. So if patients are with me, I will always vouch for the bioidentical, which means that it does come from a compounding pharmacy, but a compounding pharmacy is still run by pharmacists. It's usually a 503A and B certified location that we will get it from. And then if our patients decide to do the hormones with us or with me, we pick a dose and then we are doing, every 5 weeks we are doing labs and we are doing, check-ins, via phone or telehealth to make sure that you are actually getting relief from these medications that you're on, that we are improving your energy, that we're enhancing mood, we're enhancing your libido, and we are actually starting to see changes in your weight, and that you're able to go to the gym and you're starting to see body composition changes. So this is why so you got to do the lab first and you got to get a consultation and you got to see if this is actually right for you, because every woman goes through this period of perimenopause and menopause differently. So not all women need it. And if you do, it depends on where you are in your journey. And a lot of my patients are like, do I have to be on this forever? Most likely, a lot of my patients will choose to be on it forever because when they get on it, they feel great. So I have a woman that comes from me from Arizona. She's in her 80s. And I mean, she's still running like marathons because she's on hormones and she swears by them. And it's nice to have patients like that because then they just kind of validate, that what you're doing is really good. So we talked about hormones. Now, I can't help but also include peptides into this, and I don't know if anybody has heard of peptides, but that's also kind of like a hot topic. And what peptides are, they're short chains of amino acids that play crucial role in various biological processes. So we have peptides all over our body, and what we can do now with regenerative medicine, which is also another specialty of mine, is we can actually enhance, we can signal the body to do things better. We can signal the body to heal better. We can signal the body to make muscle better. We can signal the body to sleep better. And sometimes I do have to incorporate this into a lot of my hormone and wellness patients because hormones are not the only thing that are changing, but your cells are changing. Your mitochondria is also not working as well as it used to. So a lot of things are changing. So when my patients want to feel really good, they all oftentimes will also incorporate peptides as well into their regimen. And usually I'll start off with one or the other, or some of my patients are very motivated, and I'll start with maybe a little bit of both. And then we kind of tailor your regimen based on your needs and goals. So I'll just kind of mention there's so many peptides out there, but I will mention some that are very popular, such as this one, BPC 157. We use this a lot in our practice. It's a very, it's a very natural. BBC itself is found in your gut and lining, so it's really good for digestive issues. A lot of times, a lot of my patients have gut health issues along with their hormones. And then a lot of them have joint pain because the estrogen is so low, and they have back pain, and they find a lot of relief when they start hormones. And then if they tag on something like BPC, which is an injection, they feel even better. Another popular one is GHK copper, and that one is very popular as well because one of the things that our patients see when they're going through hormone changes is their skin is changing because they no longer have estrogen. They don't have that nice dewy look anymore. They feel very dry. I mean, I had one patient that was like, my mouth is always dry, and I don't understand. I'm like, have you checked your hormones? And she checked her hormones, and lo and behold, estrogen, of course, is low, and she was coming in for like IV therapy. And then I was like, why don't you start estrogen? And she started estrogen. She's like, oh my God, you literally cured me because I just was feeling so dry. So, I mean, estrogen dries out, with that, the lack of dries out everything. So, GHK is a common one that we see being used because it helps the skin, it helps, the hair grow. I'm actually on GHK right now, and I love the way it makes me feel. And my eyelashes are back again. So I do this peptide, a few times a year, and certainly it is one of my favorites and very popular in our practice. Another peptide is growth hormone related peptide. So as we age, our pituitary gland shrinks. So if our pituitary gland shrinks, then then its ability to release growth hormone also decreases. Okay. And why is growth hormone important? Helps you sleep better, helps you make muscle. It helps you get rid of belly fat. Okay. It helps you recover so you feel great the next day. So imagine now as a woman, your hormones are down and then your growth hormone is down. And so it's no wonder my women, when they come to me, they're not feeling good. They have no energy, they have no libido, they can't, their bodies are changing, their favorite, pair of pants and dresses are not fitting anymore. So growth hormone is one that I will utilize because I know that if I use growth hormone, I'm going to help them get to that next level in their life where they're holding muscle, they're sleeping better. And this is where longevity happens, right? Longevity happens in the amount of sleep that you get, the depth of sleep that you get, and the kind of exercise that you do. And that's really simple. And these peptides and hormones help you achieve that and maximize on that so you can live up to 80, 90, or 100, and you're still able to walk without a cane. You're still able to, lift your luggage and put it on a plane and go travel. I mean, you have to think about the long term, the ADU, because the preparation starts now. Okay. And and kind of like moving towards the end of this, we have to talk about GLP, semaglutide, tirzepatide, and some of the newer ones that are coming out, because without it, it's very difficult to get women to lose weight when they're especially in a hormone crisis. And that's because of so much inflammation that's in the body. Even if I start them on a hormone, my women don't want to wait a year to see the results. So for oftentimes I will, based on my clinical judgment, I will start them on a GLP low dose or micro dose at the same time so they can see the result. And there is something very powerful about when a woman loses weight, even of 2 pounds or 5 pounds. It's something, there is a confidence level that goes up. There is a mental health aspect that goes up. So it allows them to you stick to their goals. And I usually will do this for about 90 days, and then I will wean them off the medication. So, and it's again, this is all individual, but this is just based on based on my years and years of experience that I've been doing this. But I have to say, microdosing for some of my patients, and real dosing with the GLP, depending on where they are with their weight, how much weight they want to lose. I'm very successful when I use the GLP alongside hormone replacement therapy. So it is a powerful tool, and it is always I will help the patient decide. And if they do it, my goal is always to get them off the GLP, because what I do is I keep you guys on a lower dose. So you guys are on a lower dose, then you still have to do the work, which is eat right and go to the gym. So, but it's a tool. You use it as a tool to get you to where you want to be. And then you let go of the tool, but you've already built the good habits. So the chances of you regaining the weight goes down. So there are semaglutide, which is the older one, tirzepatide, which is a newer one. If I had to pick a favorite, it just depends. Tirzepatide is going to be a little bit more powerful because it has the ability to also suppress the appetite, but also, kill fat, which is nice. Semaglutide doesn't have that. And then there's a newer one coming out, which has three modalities, and it's called retatrutide, and that's hopefully supposed to come out this year. That's probably going to be the new favorite because it has an extra caveat where it actually increases energy expenditure. It literally thinks you're like running a marathon. So, like my patients really lose weight and they don't get all the negative stomach issues that you get with the other two. So again, we don't see a lot of negative side effects because we are starting our patients on a lower dose. We are very close with our patients. We check in a lot. We give them all the tools to prevent nausea and constipation. So because we are so experienced, we are ahead of the game as soon as we start the medication. Okay. And these are just some of these are some of our patients. So you can see here, we use a in-body scale on a lot of our patients because we really want to monitor their muscle loss. Because, you know, whenever you start a weight loss medication of any kind, you will see some muscle loss. So we need to be very vigilant. We need to be very mindful of that. So we keep track of that. And a lot of our patients do quite well where they're just losing weight and they're only losing maybe a little bit of muscle and sometimes even in some cases actually increasing it. Okay. So yeah, so we do give you guys a lot of data so you can actually see your progress. So the takeaway is women's health is not about chasing symptoms. It's about understanding the body, honoring its complexity, and supporting it intentionally. So, definitely do a lab, get a lab interpretation, but make sure your doctor is a good listener and looks less at the labs, but looks at you as an individual, and it has a very personalized approach. And I'll tell you now. I'm seeing a lot of internal medicine, OB/GYN doctors actually being very starting to prescribe it, but which is great actually. I'm very happy to see that. But they don't have the experience that I have. They oftentimes a lot of my patients are not getting their labs done to see if the dosages that they're on are appropriate. Oftentimes the physicians don't even know like what number to look for in the labs. I do. I have a lot of data and a lot of experience. I'm very comfortable knowing where my patient should be. And then I'm also willing to incorporate things like peptide therapy, genetic testing to really just keep looking for the root cause and to really get down to the nitty-gritty so my patients can, live long and not just live long, but thrive while they're doing it. So I think this is pretty much closes my talk. So what we're going to do now is kind of show you the next steps. So if any of what I said sort of interests you, this is, I think, or kind of you've been thinking about doing this and didn't know how to approach it. Well, this is the time now because we are doing some great, obviously we're doing some good discounts and good opportunities. So, and remember, it just takes a quick lab work and just maybe a 45-minute to an hour chat and then you see if this is right for you. So I am going to now open this up to questions, and my team will read some of the questions out to me, and then yeah, let's get some answers for you guys.
Is oral vitamin D as effective as injections?
Okay, so one of the questions is oral vitamin D as effective as injections? Excellent questions. So it depends on how low it is. So if my patients are really low, like less than 30, then I'm going to use injections and I'm going to use vitamin D orally. Okay. And I'm going to go up to 5,000, 10,000 international units. So it's important to understand the dosages. But say you're somewhere between 40 and 70 and you really just you're just one of those people that wants to go up to 80, then maybe you should just take vitamin D 5,000 international units and you can forego. You don't have to take the injections. So it all depends. And if you're part of our program, because we see vitamin D being low, we actually give it for free in our program because it like vitamin D actually allows all the hormones to work better. So I need vitamin D to be optimized. So when I put my patients on hormones, it's working better. Okay. So excellent question. Thank you for that.
Is 35 too early to start using hormones?
So is 35 too early to start using hormones? Absolutely not. So the data now is what we all agree on actually is that 35 is when most of our women are starting to see it. So yes, if you feel like any of this resonated with you, please come and chat with me and please do your labs. It's not too early.
How can I ensure the peptides I'm buying are safe?
So how can we ensure peptides I'm buying are safe? Great question because I'm seeing this a lot. So you need to get your peptides from a 503 A and B certified facility. Okay. Please do not get it from online. Please do not get it from China. You don't know if there's arsenic. You don't know if there's toxins in there. Arsenic is one of my biggest fears. And if any of you guys are into methylene blue is royal for having, arsenic in there. Actually, in China, methylene blue is a controlled substance. So that should tell you something. So please, please, please find a provider that only gets it from these facilities. Okay. If you are already taking HRT prescribed from your doctor but never had labs, would you stop that? Would you stop that for a period of time before coming for you to labs and compounds? Um, Good question. It depends. I could sometimes work with, say you're in the middle of it, and and as long as I have your dosing, I can go ahead and check it, and then I can just tweak the dosing. So for me, with my level of experience, I have no problems. Okay. How do you decide what peptide is best? Okay, great question. It is all about really good history taking, okay? Really good history taking, finding out what you need, looking at the labs for support, and then pretty much matching the peptide. Sometimes I will start off with like two of them, and then you will do this for 2 to 3 months, and then we will try a different one. And then when I start with the patient, I only try a few of them at a time because I need feedback. I need to know what is working for you, what is not working for you. And then once, say my patients are with me for a year, I know their peptides now. So now they just go ahead and start rotating them. It's pretty easy. Um, is it optimal to use injectable peptides? Also, what would be the frequency or does it vary? So, peptides don't always all have to be injectable. Most of them are, but some of them I actually prefer them in a tablet form because some of them I want them to go through the gut lining because I'm trying to, maybe that's my goal. Maybe I'm trying to maximize their gut health. And sometimes because I want to give them a little break from all the injections, or my patients are traveling, I want to have some, non-injectable options. So I mix them because and also your body gets a little fatigued. I mean, sometimes having 3, 4 injections is just a lot. So great question, but I do mix them, and the frequency it all depends. What advice would you give to someone who's curious about hormone replacement but feels overwhelmed or intimidated by where to start? Come in for a consult. Let's do some labs and let's have an intimate conversation. And I swear you will feel very informed and not intimidated after our talk. Do you currently have retatrutide? So, great question. Retatrutide is technically we shouldn't be giving that out yet because none of the 503 A and B sites have it. So with that being said, We are waiting very patiently because I really would like to use it, but I do see some people online getting it from somewhere. So just be very cautious where you get it from. Is it too late for me to begin estrogen replacement therapy if I have been on menopause for several years? Awesome question. And the answer is no, it's not too late. I don't care if you're 80, 90, or 100. If you come to my office, I will start you on estrogen. And why is that? Because estrogen does something very powerful for women. It protects your bones. Okay. If you are not on estrogen therapy, if your estrogen is low, or if you're not doing resistance training, your chance of a hip fracture goes up to 50%. And now the chances of you dying within a year goes up to 50%. Okay? But if you take hormones, it goes down 50%. So this is the main reason. I don't care what age my women are, 60, 70, 80, 90, you will get estrogen from me because I know I can protect your bones. I can protect you from a hip fracture. And my husband is an orthopedic surgeon, so I know all about fractures and I want my women to live long. Okay? Do I take insurance? I don't take insurance. And the reason for that is my hormone replacement therapies are all compounded. I also have a lot of expertise. I have been doing this for 10 years. So, yeah, there is a price tag for that. But just know that because of my expertise, um, you will get very good care. But also, I feel that my pricing compared to many other hormone doctors that I know all over the world or all over the States, I feel like I'm actually pretty quite reasonable. So now if there's issues financially, please don't let that be the reason because we can help you find a way to afford them. And even now, I feel like insurance companies should be allowing you guys to, you can always submit it. So we have done that for a few of our patients. So I hope that helps. For the peptide GHK, is that just an injection you take every month or how often do you receive? Yeah. So GHK, I often will tell my patients to take it up to 3 months. And the reason for that is your hair and your skin has a 28-day cycle, right? So if you just take it for a month, you're not going to see the value. So take it for 3 months and then go ahead and just put it on pause for a little bit and maybe try another one or take a break and then come back to it at some point this year. But I absolutely love it. It's probably the reason like right now my skin is just glowing and yeah, it's but yes, you could take it for up to 3 months. Next question is if I had hormone positive breast cancer, I'm curious, what would you be available to me? Also, do you take HSA? Do we take HSA?
It depends.
Okay,
You can
so
try.
but we can try HSA. So great. Now, if you have hormone positive breast cancer, here's the thing. So if you are 3 years out of being treated, I am comfortable treating breast cancer patients. But I will not use anything that goes through the liver like a tablet, but I will use patches or I will use dissolvable tablets. So this way it just goes through, it does not go to the liver, it just goes straight to the bloodstream. So it all depends. And then if worst case scenario, if you're still uncomfortable or we feel like maybe it's too risky, you can at least do vaginal estrogen, no problem. Okay? Does insurance cover this? I think I answered that already. What if I've already been on HRT for a year? Can we still work together? Absolutely. Come on down. I get patients like that all the time. Also, if I just got labs done for hormones, can I bring those and we go over them choose which treatment is the best for me? Yes. If you have hormones already, bring them in. And if I need additional data, I'll just send you to the lab. So no problem at all. I conquered breast cancer last year. It was estrogen responsive, so I cannot take HRT. Any suggestions? So yeah, so this is these are some of the cases where unfortunately we don't have data. But if you read a book called Estrogen Matters, which was written by a cancer doctor, he gave his wife hormone replacement therapy, well, and she had breast cancer. So this is there's so much debate here about this, and unfortunately we don't have the right answer. But what I will tell you is, it depends on the patient because some of my patients are miserable, and if they are going to opt for anything, they probably will not do synthetics, and they will do bioidentical because if you look at the data, bioidentical has less risk for reigniting breast cancer. But again, we don't have enough data, but like I will help my patient decide this, but at the very least, you can do vaginal estrogen, no problem. What are your thoughts on NAD? I like NAD, but I think NAD is often abused. Maybe not, if you don't understand the biochemistry, then maybe you should not be prescribing it. So I need a reason to treat NAD. Everyone after 60, age 60, you're getting NAD, okay? And you're getting it for at least 6 to 8 weeks. Anyone over 40, depends on what your goals are, you're most likely going to get some round of NAD. But I only do it for 6 weeks. And then I will do other things like 5-amino 1Q, or I'll give you supplements that keep your natural NAD going. Okay. And then say you got sick or you got injured or you just ran a marathon, then I'm going to give you NAD. So I need a reason for it and I will cycle on and off, but I will not be like the people in social media where they're taking it all year long and they have no understanding of why. That's just not how I practice because I know there are cancer risks to that. Okay. Can you talk a bit about cost? We probably will not talk a bit about costs here, unfortunately. I'm sorry about that, but you are welcome to call the office and we will give you pricing. Absolutely. What about low ferritin level? My alkaline phosphatase is low, already doing B12 injections bi-weekly at home since that is low. Vitamin D is low, taking orally. Yes, we look at ferritin a lot as well because a lot of my women have low iron. So my job is to optimize you in all of those. So if you have low ferritin, you can take iron, but there are specific iron that you can take, like iron bisglycinate, okay? Because that will not mess up your gut. 'Cause a lot of my patients get constipated. If you're taking B12 injections, your biweekly, your goal should be. So I guess my question to you is, do you know why you have B12 deficiency where you're taking biweekly? Do you have some sort of methylation issues or MTHFR gene issue? We should probably find out. So yeah, I think if whoever this is, please set up a consultation. And vitamin D, you got to just make sure you're taking enough of it. 5,000 international units, 10,000 to really see the change. If I don't have to lose weight, can I use GLP for the other benefits? Absolutely. So on low doses, like 1 milligram, right? The maximum is like I mean, there's like up to 100 units, even like 10 units, 5 units. There are some longevity. I do take GLP for longevity purposes. Okay. And also, lowering inflammation, lowering, water weight, helping me stay lean, without even thinking about it, and staying away from like unnecessary junk food. And also, I'm very busy and don't have time to eat, so I just don't even think about food. So, there are many reasons to take GLP. Great question. Labs are covered by insurance because we do them through LabCorp, and we make sure we put the right codes in. I felt the copper peptide was affected. I did the injection. Is that in a pill form at Hebe? It is not in a pill form, but you can use it as like a cream. Or sometimes some of my patients also use it as drops in their hair to make it grow. It works really well as well. Does that mean estrogen would help with those with osteoporosis? Absolutely. But if you already got it, that's not good. But you can still take it because you want to make sure it doesn't get worse, and absolutely take it to prevent it. Okay. Is pricing listed on your website as well for peptides? It's not, so please call us. Will you make a super bill for insurance? Yes. I'm interested in estrogen replacement, but I'm concerned about blood clots because of my age. What are the risks? So, you don't for so if you are worried about blood clots, just don't take it in a pill form. Take it in a patch or take it in a pill that dissolves and bypasses the liver. If it bypasses the liver, you're good to go. Do we have direct access with you for questions when on membership? Because I have a hard time contacting my OB. Yes, we have a concierge service. So all my patients on hormone replacement therapy do get my number, and you have direct contact with me and my nurse. Has there been use of hormone peptide therapy for endometriosis? Endometriosis is tough, but since technically, if it is an inflammatory, phenomenon, so yes, there are peptides options for that. Do you recommend NAD for women under 30? I don't. And okay, I think that's most of the questions. Okay, that was really good question, guys. Thank you so much. So, um, let's see, there's another one coming in. I no longer have a gallbladder. Does this affect anything I take? No, so if you don't have a gallbladder, that probably makes it easier for you to take a lot of things. But injections are going to be really good for you. I think that's pretty good. All right. All right. Thank you so much. I hope we hear from you guys. I'm excited to do some consultations at least. You don't have to commit to anything, but at least let's have a chat. And yeah, thank you for taking the time about something I'm so passionate about. All right. Have a good night.